Hello and welcome. Here is the truth that not enough people say out loud. When you reach a certain age, the world has a way of making you feel invisible. Like the system has quietly decided that your best years are behind you and that you no longer need to be at the front of the line. But I want you to know something. You are not invisible here. You matter deeply. And the heart that has been beating inside your chest every single moment of your life deserves every piece of information that could protect it. Here is what nobody tells you. A heart attack does not always look the way you think it does. It does not always announce itself with the dramatic chest-clutching scene you have seen on television. For many seniors, over 60, a heart attack announces itself weeks or even months in advance with signals so quiet, so ordinary, so easy to dismiss that most people wave them off and carry on with their day. And that is exactly what makes them so dangerous. Today, we count down 7 heart warning signs that seniors over 60 must never ignore. Some of these you may have heard about, but several of them will genuinely surprise you. And when we reach number 1, you will discover the warning sign the American Heart Association says affects hundreds of thousands of people every single year, and most of them never even realize it is happening. Your heart has been working for you without a single day off since before you were born. Today, we work for it. Before we begin, let us know in the comments your age and where you are watching from. We read every single one. Now let us get started with number 7. Number 7, swollen ankles and feet. We are starting our countdown with a warning sign that most seniors notice, file away in the back of their minds, and then completely forget about. You take your shoes off at the end of the day. Your ankles are puffy. Your feet feel tight. You think it is from standing too long, or the heat, or just getting older. And maybe sometimes it is. But here is what you need to know. When the heart is not pumping efficiently, blood backs up in the body, and because of gravity, it pools in the lowest places first. Your ankles, your feet. Your lower legs, that swelling is your body waving a flag that your heart may be working harder than it should, just to manage basic demands. The American Heart Association lists ankle and foot swelling as one of the primary warning signs of heart failure. It can develop so gradually that each day feels only slightly worse than the last, which is exactly why it goes unnoticed for so long. The pattern to watch for is swelling that worsens toward the end of the day, shoes that fit comfortably in the morning but feel tight by afternoon, socks leaving deep indentations in the skin, an unexpected weight gain of 2 to 3 pounds in a single day or 5 pounds in a week. What you can do right now, first, talk to your doctor. But while you wait for that appointment, here are 3 practical steps. Step 1, foot elevation. Sit in a comfortable chair or lie in a bed. Place 2 firm pillows under both legs so your feet are raised higher than the level of your chest. Stay in this position for 15 to 20 minutes. You should feel the tightness in your ankles gradually ease as gravity helps pull excess fluid back toward the heart. Step 2, ankle pumps. Sit upright in a chair with both feet flat on the floor. Slowly lift your toes toward the ceiling while keeping your heels firmly on the ground. Hold for 2 seconds. Then, press your toes back down toward the floor so your heels lift slightly. Hold for 2 seconds. That is 1 full repetition. Do this 20 times on each foot. This movement activates the calf muscles, which act as a natural pump, pushing blood back up through the veins toward the heart. Step 3, a 10-minute morning walk. Walk at an easy, relaxed pace for 10 minutes, either outside or around the house. Keep the pace slow enough that you could speak in full sentences without any difficulty. This level of movement stimulates circulation in the legs and prevents fluid from settling as the day progresses. These steps reduce discomfort and support circulation, but they are not a substitute for a medical evaluation. Make that appointment. While ankle swelling announces itself slowly, the next warning sign sneaks up on people in a much more unexpected way. Number 6, unusual fatigue that rest does not fix. Number 6 is the one that gets dismissed more than almost any other warning sign on this list. You feel tired, bone tired. Not the kind of tired a good night's sleep resolves, but a deep and persistent exhaustion that sits with you from morning to night without a clear cause. You assume it is your age. You assume it is because you did not sleep well. And then another week passes, and you feel exactly the same. Here is why this matters for the heart. When the heart is not pumping effectively, every organ and muscle receives less oxygen and less fuel than it needs. Your muscles tire faster, your brain feels foggy, your body starts rationing energy because there simply is not enough to go around. The result is that overwhelming, inexplicable fatigue that coffee and rest cannot touch. The American Heart Association has specifically highlighted unusual fatigue as one of the heart attack warning signs that women most commonly report in the days and weeks before a cardiac event, not chest pain. Just a depletion that does not match what they have been doing. What to look for is a meaningful shift from your normal baseline. Activities that used to feel routine now feel like genuine effort. What you can do right now. Step 1. Use the talk test to pace yourself safely. During any light activity, such as a short walk, say a full sentence out loud. For example, today is a good day for a walk. If you can say it comfortably without pausing for breath, you're at a safe exertion level. If you cannot finish the sentence, slow down or stop and rest. This simple test keeps you active without placing too much demand on the heart. Step 2. Drink water consistently throughout the day. Place a full glass of water on the kitchen counter first thing each morning and drink it before doing anything else. Then aim for 1 glass every 1 to 2 hours through the day. Even mild dehydration thickens the blood and forces the heart to work harder, which makes fatigue significantly worse. Step 3. A short, gentle morning walk. Step outside or walk the length of your home at a slow and comfortable pace for 5 to 10 minutes. The effort should feel completely effortless, and breathing should stay easy and relaxed throughout. This gentle movement improves circulation and tends to produce more real sustained energy than lying still does. If fatigue is so severe that even minimal activity feels overwhelming, seek medical attention. Do not push through it. Listen to it. Number 5 is the warning sign that sends most people to entirely the wrong doctor. Number 5, jaw pain with no dental explanation. Number 5 is the warning sign that has sent more people to the dentist than to the cardiologist. A dull ache in the jaw. A soreness along the lower jaw that comes and goes. Maybe it worsens when walking quickly or climbing stairs. Maybe it eases when you sit and rest. The dentist finds nothing. The x-rays are clear. The diagnosis is stress or teeth grinding, and the patient goes home having completely missed the real message. Here is what is actually happening. The heart shares nerve pathways with the jaw, neck, and upper body. When the heart muscle is not getting enough oxygen, it sends distress signals through the nervous system. But those signals do not always arrive where expected. The brain misinterprets their source and reads the pain as coming from the jaw, shoulder, or arm, rather than the chest. Cardiologists call this referred pain. The pain is entirely real. It is just not where you think it is. The American Heart Association specifically lists jaw pain as a heart attack symptom, and it appears far more often in women than in men. What you can do right now. Learn to distinguish between dental jaw pain and cardiac jaw pain. These two types behave very differently, and that difference can be life-saving. Dental jaw pain is usually felt in one specific spot, near a particular tooth or the jaw joint. It stays constant throughout the day, regardless of whether you are sitting still or moving around. Cardiac jaw pain behaves very differently. It tends to be felt across both sides of the lower jaw, rather than one localized spot. It appears or becomes noticeably worse during physical activity, such as walking, climbing stairs, or carrying groceries. And it eases or disappears entirely within a few minutes of sitting down and resting completely. If jaw discomfort follows that second pattern, stop what you are doing immediately. Sit down on a chair or step. Stay still for 5 minutes. If the discomfort eases with rest, that is a significant cardiac warning sign. Call your doctor or emergency services right away. Do not resume the activity and do not drive yourself anywhere. If you have recurring unexplained jaw pain and cardiovascular risk factors such as high blood pressure, diabetes, high cholesterol, or a family history of heart disease, ask your doctor proactively for an ECG and a cardiac stress test. These two tests together give the clearest possible picture. The next warning sign connects heart health to something most people never think to associate with the heart. Number 4, shortness of breath during simple activities. You used to take the stairs without a second thought. Now you take the elevator. You used to walk from the car to the store and back without stopping. Now you pace yourself. You used to talk and walk at the same time. Now one of those things has to wait. This is not getting older. This is a warning. When the heart struggles to pump blood efficiently, fluid can build up in the lungs. Not all at once, but gradually enough to make breathing require more effort than it once did. The medical term is pulmonary congestion, and it is one of the hallmark features of heart failure, which the National Heart, Lung, and Blood Institute identifies as one of the most common reasons adults over 65 end up in hospital. People adapt to this so naturally that they reduce their activity without ever recognizing that their heart is quietly struggling to keep pace. Harvard Health has highlighted unexplained breathlessness as one of the most commonly overlooked cardiac symptoms. What you can do right now: see your doctor about new or worsening breathlessness. In the meantime, practice this breathing exercise every morning. Sit upright in a chair with both feet flat on the floor. Place one hand on your chest and the other on your belly just below your rib cage. Breathe in slowly through your nose for a count of 4. As you inhale, focus on pushing your belly outward against your lower hand, while the hand on your chest stays as still as possible. Then breathe out slowly through your lips, as if blowing gently through a straw for a count of 6. As you exhale, feel your belly fall back inward toward your spine. That is one full breath cycle. Repeat this 10 times without rushing. This is called diaphragmatic breathing. It uses the large dome-shaped muscle beneath the lungs more efficiently, reduces the work of each breath, and eases breathlessness by helping the lungs exchange air more fully with every cycle. Practice this sitting quietly for 5 minutes each morning. Also, monitor your sleep position every night. If you are adding extra pillows because lying flat makes breathing uncomfortable, or if you wake up gasping for air, contact your doctor immediately. If you're finding this video helpful, please take a moment to like, subscribe, and hit the notification bell. Now, let us move to a warning sign that lives inside your sleep. Number 3, sleep problems that feel like just bad nights. We have all been told that sleep gets worse as we age. So when it does, we accept it without question. But 2 specific sleep disturbances have a direct and documented connection to serious heart disease. And knowing the difference between ordinary poor sleep and a cardiac warning sign could save your life. The first is waking up in the middle of the night, struggling to breathe. When you lie flat, fluid that pooled in your legs during the day redistributes into the lungs while you sleep. A healthy heart handles this shift quietly. A struggling heart cannot, and the fluid triggers that sudden, breathless awakening. If this has happened to you even once, report it to your doctor, not next week. Now, the second is obstructive sleep apnea, where the airway repeatedly collapses during sleep. Every time breathing stops, oxygen drops, blood pressure spikes sharply, and the heart is forced to work under sudden strain. The American Heart Association has confirmed that sleep apnea is directly linked to heart failure, arrhythmias, stroke, and coronary artery disease. It is not just a snoring problem. It is a cardiovascular risk factor. What you can do right now: if you wake up gasping for breath, tell your doctor immediately and ask about a home sleep study. For this test, you wear a small clip-shaped device on one fingertip overnight while sleeping in your own bed. It monitors your oxygen levels and breathing patterns passively as you sleep normally. No wires, no clinic stay. If sleep apnea is confirmed, CPAP therapy is the most effective treatment. With CPAP, you wear a soft mask over your nose and mouth at night. The device gently pushes a steady stream of air through the mask, keeping the airway open so breathing never stops. Most people report dramatically better sleep and lower blood pressure within the first few weeks of using it consistently. For heart protective sleep habits, go to bed and wake at the same time every day, including weekends. Keep the bedroom cool and as dark as possible. Finish eating at least 2 to 3 hours before bed. If you wake at night feeling breathless, sit upright on the edge of the bed with both feet flat on the floor. This position helps fluid drain away from the lungs. Breathe calmly for 2 to 3 minutes. If the breathlessness does not ease, call for help. The next warning sign carries special significance, particularly for women. Number 2, nausea, indigestion, and stomach discomfort. An upset stomach, a wave of nausea, a burning sensation in the chest or upper abdomen that feels like heartburn or indigestion. You had a heavy meal, you tell yourself, or something disagreed with you. But when these symptoms appear without a clear dietary explanation, or when they arrive alongside any other sign on this list, they need immediate attention. The heart and the stomach are neighbors in the body, and they share nerve pathways. The distress signals of a heart attack can travel through exactly the same routes that process digestive discomfort. The brain then misinterprets the source and reads it as coming from the stomach, the jaw, or the back, rather than the heart. The American Heart Association has documented that nausea, vomiting, and stomach pain are among the most common alternative heart attack presentations in women and in people with diabetes, two groups in whom classic chest pain is frequently absent altogether. What you can do right now. Know when nausea requires emergency action. If nausea appears suddenly, alongside lightheadedness, unusual fatigue, jaw or arm discomfort, sweating without physical effort, or any pressure or heaviness in the chest or upper body, do not take an antacid. Sit upright in a firm chair with your back straight and your feet flat on the floor. Staying upright reduces pressure on the heart and helps maintain blood flow to the brain. Call emergency services immediately and stay on the line until help arrives. For everyday management, switch from 2 or 3 large meals per day to 4 or 5 smaller ones spread across the day. A large meal diverts significant blood flow to the digestive system at once, increasing the heart's workload sharply in a short window. After each meal, remain sitting upright in a chair for at least 2 hours before lying down or reclining. Reduce coffee, strong tea, and alcohol, particularly in the evening. Both caffeine and alcohol relax the valve between the stomach and esophagus, which worsens acid reflux, and both place additional strain on the cardiovascular system simultaneously. If your digestive discomfort tends to appear during or shortly after physical activity and eases completely with rest, report that exact pattern to your doctor. That specific detail is what a cardiologist needs to hear. And now we arrive at number 1, the warning sign that by definition you will never feel coming. Number 1, the silent heart attack. Number 1 is the warning sign that is not a warning sign at all. The silent heart attack. A real and full cardiac event that leaves genuine damage to the heart muscle and produces no chest pain, no collapse, and often no symptoms that the person recognizes as significant in any way. The American Heart Association has confirmed that roughly 1 in 4 heart attacks are silent. They go undetected at the time they occur and are discovered later on an ECG, showing up as scar tissue the person has no memory of acquiring. Diabetics are particularly affected because a complication called cardiac autonomic neuropathy progressively damages the nerves that should signal distress when the heart is in trouble. The alarm fires in an empty room. In women, the situation is different, but the outcome is the same. Women more commonly develop disease in the smaller branching arteries of the heart rather than the large central ones, a pattern called microvascular disease. This restricts blood flow and causes real damage without producing the classic crushing chest pain most people expect a heart attack to feel like. What you can do right now: schedule a cardiac checkup that includes an ECG, even if you feel completely fine. An ECG is painless and quick. You lie flat and still on a table or bed. A nurse places 10 small sticky sensors called electrodes on your chest, arms, and legs. Connecting wires run from the sensors to a machine beside you. You are asked to lie still and breathe normally for about 30 seconds while the machine records your heart's electrical activity on a printed strip. The full test takes less than 5 minutes and causes no discomfort. This single printout can reveal whether a silent heart attack has already occurred, whether dangerous rhythm abnormalities are present, and whether further investigation is needed. If you have multiple risk factors, also ask about a cardiac stress test. For this test, you walk on a treadmill or pedal a stationary bike at gradually increasing speed while connected to heart monitors. Your doctor watches how the heart responds to increasing demand. The test is fully supervised and stops immediately if any concerning sign appears. Daily habits that reduce the risk include walking 30 minutes at a comfortable conversational pace on most days, reducing sodium by cooking with herbs and lemon rather than salt, measuring blood pressure each morning with a simple arm cuff device before eating or drinking, and sharing those readings with your doctor. And if you have diabetes, keeping blood sugar within the range your doctor recommends. Your heart has been loyal to you every single day of your life. Give it the check-in it deserves. Here is what today's countdown tells us, and it is worth holding on to. The heart does not always shout when it needs help. More often, it whispers. Through swollen ankles at the end of the day, through fatigue that rest cannot fix, through jaw pain that makes no dental sense, through breathlessness on a walk that once felt easy, through disrupted sleep, through nausea with no good explanation. And sometimes it does not whisper at all, because the alarm system itself has gone silent. 7 warning signs. And for each one, something real and practical you can do today. Elevate your feet and do your ankle pumps this evening. Use the talk test on your next walk. Drink a full glass of water before your morning coffee. Practice your diaphragmatic breathing for 5 minutes. Protect your sleep with a consistent nightly routine. Eat smaller meals and sit upright after eating. And most importantly, book that cardiac checkup and bring your list of questions. You deserve to know these things. You deserve to have someone explain them clearly and treat you as fully capable of understanding and acting on your own health. You are not invisible, and your heart is worth fighting for. Which of these 7 warning signs surprised you most? Leave it in the comments below. We read every single one, and your experience might be exactly what someone else watching right now needs to hear. If you like this video, please like, subscribe, and hit the notification bell so you never miss the next one. And share this with someone you love who is over 60. It might be the most important thing you share with them this year. Thank you for watching, and we will see you in the next video.